Our topic was vaccines for children.
Addie Parks.
Dominique Popa.
Carson Rather.
George Ross.
Aiden Ross.
A little background is childhood immunization policies have grown and changed over time in many countries in the United States. A key policy was the National Childhood Vaccine Injury Act of 1986. The act was created to address vaccine safety concerns and make sure there's a steady vaccine supply for all and build a trust and growth in immunization programs. The why is public health protections, safety measures, controlling deadly diseases, minimizing pandemics and public outspreads, and educating individuals on vaccinations and benefits. And then the people that advocated for this were public health official organizations, parents, advocacy groups, and vaccine manufacturers.
Um, what is it? So the components of this program is that it provides vaccines to eligible children under 18, including children who are Indigenous, Medicaid eligible, uninsured, or underinsured, meaning their insurance doesn't cover vaccinations. And they can be administered at schools, the Department of Health, with healthcare providers or clinics. And the goals are to provide vaccine access to all children, including those who cannot afford it, reduce cases of preventable diseases due to cost of vaccines, minimize barriers to vaccinations, and protecting children's health. And some of the benefits that have been seen from 1994 to 2013 is that there's been a drastic decrease in hospitalizations, confirmed cases, and deaths due to these illnesses. It's saved net 300 billion in directly associated costs and over a trillion in indirect costs. And it's estimated to have prevented around 300 million illnesses, 20 million hospitalizations, and 700,000 deaths.
So a little bit about why people are for this program is mainly it's due to the herd immunity against diseases such things as measles, polio, vaccines in the earlier times before vaccines became widely popular. If somebody got one of those diseases, especially in children or infants, it became very deadly and it could spread very quickly. So a big part why people were for it is because it allows a lot of people to gain access to the vaccines that are needed to protect them from these deadly diseases. Uh, as an example, polio devastated the youth population in the 1900s. Before the vaccine came out, kids would get polio, and there was no way for them to. A lot of kids unfortunately died because there was no way for them to fight the disease. But then once the vaccine became available, a lot of kids started to get it, and polio eventually started to go away, and it's very rarely you'll ever see it now. Um, Another reason why people are for it is it just made it a lot more effective. It was a much better way to vaccinate the population due to the fact that it was easier to obtain and also it cost less than before. And then some reasons why some people are against it. There has been, unfortunately, cases of fraud. There was a study done where a lot of the providers that the study was looking at didn't have protections against fraud from the vaccine providers. This could cause some problems with the vaccines because there's in some of these cases there was no protection against abuse or fraud, and that could lead to issues with the vaccines that were being distributed to the patients. And finally, free choice. Although it is a voluntary program, there are still a lot of parents who don't want their kids to receive vaccines, and there's still a lot of anti-vaccine sentiment in the United States. So there's a lot of people still against this policy.
So next, we're going to look at how our vaccine policy aligns with the NASW Code of Ethics. So what we see is that the Social Work Code of Ethics, it mainly aligns with our policy. It will further help social workers correctly conduct work with their clients. Some examples of it, like how George mentioned earlier about some parents for religious or medical beliefs don't believe in vaccines, don't want their children to be vaccinated. and that can comply in Section 1.5 entitled Cultural Competence, highlights that social workers must abide by their clients' beliefs, like said earlier, those who have religious reasons, medical reasons, thinks that vaccines cause autism, which is really important for implementing this policy. As well, working in the medical field requires workers to not disclose information. Section 1.07, entitled Privacy and Confidentiality, requires workers to not disclose some medical information unless told to by the client or by a court. This would apply, which would force administrators to keep information confidential, shared between themselves and the client, because some people do have these concerns out there in the world that maybe that their beliefs will get leaked or that something will go wrong in the medical field, and that might be able to get rid of some of the hesitancy towards getting the vaccines and may allow more people to get them.
A question for you to think about. According to your own beliefs, do you believe the childhood vaccines are a good use of government money?